Hello, everyone. Thanks for joining me. My name is Jeff Reddycup, and I'm a Quality Improvement Advisor with Great Plains Quinn. Today, I'll be giving you all an overview of the PATH project and reviewing the milestones, as well as your facility's current performance and each one of the associated metrics. The Partnership to Advance Tribal Health, or PATH, strives to improve population health among American Indian and Alaska Native communities. With the support of federal, state, and local partnerships, PATH works with Indian Health Service, healthcare facilities, and area offices to develop a unified we approach to advance tribal health in the 7 states PATH serves. The PATH initiative seeks to improve quality of care for American Indian and Alaska Native people by implementing best practices and identifying operational improvement needs. Great Plains Quality Innovation Network, serving North Dakota, subcontracts with Comagine, who partners with Indian Health Services and their hospitals. Great Plains Quinn supports IHS hospitals through the PATH initiative to develop leaders through training and networking, build strong hospital systems through team-based care and clinical quality improvement, strengthen patient, family, and tribal engagement, promote and spread best practices in hospitals, ensure that clinical, operational, and safety standards are met or exceeded, assist with the development of hospital improvement plans, and establish baseline data to ensure plans for improvement are successful and sustainable. The PATH mission and core values are to collaborate with IHS hospitals to transform patient care and improve the health of American Indian and Alaska Native people using patient-centered, evidence-based, culturally appropriate resources while addressing unique healthcare quality challenges and leveraging the local trusted relationship across our region. The PATH STAR was established in the previous PATH work and still holds true. The circle around the star shows the collaboration and trust built to support healthcare teams, IHS facilities, and patients to help improve their overall health. The project has 4 primary focus areas with the IHS quality framework and the strategic priorities and goals, and is key to success over the next 4 years. The first focus area is to improve patient safety and concentration on reduction of patient harm. The second focus area is improving behavioral health outcomes, including decreased opioid misuse, which will target many behavioral health areas, including substance abuse, mental health disorders, and suicide prevention. The third focus area is increasing quality of care transitions, which will examine and address factors affecting post-discharge care and transitions across settings, reducing readmissions and improving access to care, and increasing the use of telehealth. The fourth area is responding to public health emergencies. COVID-19 pandemic and the opioid crisis have highlighted the need for comprehensive emergency preparedness and response. This can include infection prevention and control across the healthcare system, with our focus on the hospital. Your facilities have been challenged in 2023 and previously with the COVID pandemic, and what are some of these, as well as the adjustments you have made. We have a team here at Great Plains Quinn to support your Quentin Burdick team. Each of the team members brings a little different experience and knowledge to the table. I'm Jeff Reddycup, and I'm your facility's primary contact. Tasha Peltier is the primary contact for Standing Rock, and Natasha Green is the overall project manager for our region. Here are the IHS strategic priorities and goals through 2024. As you can see, there are many aligned goals to the PATH focus areas. We really find it important to align our work with the work being done at each of the area offices. To date, a lot of our time has been spent on the quantitative milestones, particularly during the first year of our project. One of those was all-cause harm. The inpatient milestones have three main areas: all-cause harm, which comprises 10 measures in 4 harm areas: adverse drug events, pressure ulcers, sepsis, and hospital-acquired infections; 10% reduction for larger census hospitals; and no increase in harm rates for lower census hospitals, which is the group that Quentin Burdick is in. Within readmissions, there are 3 milestones: overall reduction in readmission rate of 5% for larger census hospitals, 3% reduction for the top 3 diagnoses for each larger census facility, and no increases for readmissions in low census facilities, again, of which Quentin Burdick is in that group. The opioid milestone has 1 item, which is a 7% reduction in the adverse drug event opioid events. The first focus area that we're going to take a look at today is patient safety. IHS federally operated Medicare participating hospitals with smaller censuses will have the following: 100% of IHS federally operated Medicare participating hospitals will have a process in place to provide data and will develop a plan to reduce readmissions by March 31st of 2021, which has already passed, and that project is in process. Each IHS federally operated hospital with low census with 1 or less readmissions will have no increase in readmissions by July 31st, 2024. And third, each IHS federally operated hospital with low census will have no increases in harm rates by July 31st, 2024. The next measure that I'd like to review is that 100% of facilities with low census and 50% of critical access hospitals will report data to NHSN quarterly by July 31st of this year. We're happy to provide any kind of technical assistance on NHSN reporting that any of the facilities in our region may need. The next area that we'll review today will center around tools, resources, and support that will sustain compliance. Milestones for this area are: first, 100% of IHS federally operated Medicare participating hospitals will have completed a review of their QAPI program by December 31st, 2021, which has already occurred. 2, 100% of IHS federally operated Medicare participating hospitals will have a QAPI program integrated into all hospital departments by July 31st, 2022. Again, this has already occurred at your facility. And third, 100% of IHS federally operated Medicare participating hospitals will have a minimum of 1 QAPI project within the hospital underway by September 30th, 2022. And also, your facility is meeting this metric. So within our second sustaining compliance slide, 90% of hospitals will maintain or achieve accreditation status by July 31st, 2024. NHSN Central Support is currently providing ongoing technical assistance, and technical assistance is also being received from Central Support for the quality payment and PI reporting programs as well. 100% of IHS federally operated Medicare participating hospitals will have a minimum of 1 QAPI project within the hospital underway. So far, what has been offered is accreditation and certification, open office hours, NHSN Central Support, and the updated QAPI self-assessment tool and QI continuum. And these three are all areas of tools and resources that have been offered for your facility. The third milestone that we'll talk about today will involve care coordination. First, 75% of inpatients discharged from IHS federally operated Medicare participating hospitals will have a post-discharge contact within 2 business days after discharge by January 31st, 2021. And this excludes patients that come through the emergency department. Second, 100% of inpatients discharged from IHS hospitals will have a post-discharge plan by July 31st, 2021. And again, this excludes all patients that come through the emergency department. Within the emergency department, 50% of those patients seen in IHS federally operated Medicare participating hospitals with provider follow-up required in the ED have a required discharge plan, and they're required to have a post-discharge contact within 2 business days after discharge by January 31st, 2022. And second, with the ED patient population, 90% of the emergency department patients seen in IHS federally operated Medicare participating hospital emergency departments will have a post-discharge plan in place by July 31st, 2024. 50% of the left without being seen patients from IHS federally operated Medicare participating hospital emergency departments will have a follow-up contact within 2 business days after leaving without being seen by January 31st, 2022. 100% of IHS federally operated Medicare participating hospital emergency departments will complete monthly random samples of emergency department charts to determine a baseline triage accuracy rate utilizing ESI and develop a plan to improve the rate by March 31st, 2022. 100% of IHS federally operated Medicare participating hospital emergency department services will include a monthly triage ESI review in their QAPI program by July 31st, 2022. IHS federally operated Medicare participating hospital EDs will also have at least a 90% accuracy rate for ESI by March 31st, 2023. "100% of IHS federally operated Medicare participating hospital emergency departments will establish a baseline for timely triage and timely medical screening examinations, MSEs, by March 31st, 2022. And IHS federally operated Medicare participating hospitals providing ED services will improve each of the following by 20%. Triage, timeliness, MSE timeliness, and left without being seen rates by March 31st, 2023. "100% of IHS federally operated Medicare participating hospital EDs will utilize ESI category findings to develop a plan to reduce emergency department utilization by July 31st, 2022. Some of the things that we have done to provide support in this area are offer an affinity group for ED utilization and ESI, work through ESI collection methods and successes, provide reference documents and short stories of success, provide best practices and ED utilization through a learning circle, and provide information on care transition measure status briefs. The final milestone that we're going to be reviewing today will be behavioral health. IHS federally operated Medicare participating hospitals will decrease opioid adverse event rate, including deaths, by 7% in the acute care setting by July 31st, 2024. The parts of this piece include 100% of IHS federally operated Medicare participating hospitals will complete an assessment of all inpatient opioid-related adverse events by July 31st, 2022. Also, 100% of IHS federally operated Medicare participating hospitals will be trained in strategies that can be used to screen patients for potential substance abuse, such as through the National Institute on Drug Abuse, Modified Assist Drug Screening Tool by September 30th, 2022. The third piece within this metric is 100% of IHS facilities will identify strategies and support spread of enhanced uptake of naloxone co-prescribing if and when opioids are prescribed by January 31st, 2023. IHS facilities will also reduce opioid adverse event rate in the acute care setting by 4% by July 31st, 2023. Some of the offerings that PATH provides to help with this particular area are HOPE Committee collaboration, opioid dashboard office hours, instructions on how to incorporate your opioid stewardship plan along with the plan template, a learning circle around opioid adverse events and harm reduction, and the development and dissemination of a communications packet on reducing opioid harm. Now we're going to take a look at how Quentin Burdick is performing in the different measures within the 5 milestone categories. So each of the next 3 slides have color codes under the current performance column to give you all an idea of where your facility is currently at. And as you can see here, Quentin Burdick is doing well in the areas of behavioral health and ESI accuracy, but still have some work to do in the areas of MSE timeliness, left without being seen rates, and preventing an increase in harm. I do have some good news for you all. Towards the end of April or in May of this year, the PATH team will be producing and distributing a dashboard tool for these measures so that your facility will be able to look at the historical data and current performance and be able to use that information to see what areas you're doing well in and also identify those in need of improvement so action plans can be developed. As you can see by this slide, your facility is doing well in the areas of patient safety and in 3 of the 5 care coordination measures. So keep up the good work. There's still some work left to do to decrease the left without being seen rate, which may be the next quality improvement project to initiate within the near future. The opioid reduction in adverse events work has yet to start. We hope to have some measurable metrics available soon in the area of data utilization for ED patients that will help your team better understand their health vulnerabilities. Keep in mind for the inpatient follow-up discharge calls, patients 18 or older who are discharged home or to home health are those who need to have the follow-up calls performed. Our final group of measures here show that you're all doing well in the area of public health emergencies, NHSN reporting, and sustaining compliance. Work in the area of reducing mortality from opiates and developing protocols to mitigate public health emergency impact has yet to begin. One of the big patient safety goals for this project is reducing readmissions. And it's very encouraging to see how your facility is performing in this area. Creating a harm-free and highly reliable care environment continues to be a work in progress, as there are some categories within this measure where a relative improvement rate isn't quite yet occurring. If you have any questions about any of the information that's been reviewed today, please feel free to reach out to myself, Tasha Peltier, or Natasha Green at the contact address listed earlier in the presentation. Thank you so much for your time today, and have a great rest of your day.